We've always known he's different, a little weird, or maybe a lot, with a tendency to do and say things you would never expect from a president. And maybe those were the signs, staring at us in plain sight. Signs that grew larger and louder until nobody could ignore them. The most powerful office in the land setting the stage, reminding us truth is stranger than fiction, and the unthinkable becomes reality. The story of a president drifting into the fog. The story of a president falling into a state of dementia. Could it be?
They're reporting on the recent strange behaviors of Trump, behaviors that indicate a legitimate mental and cognitive decline. I'm going to analyze what they found, and I think we're really zeroing in on what type of dementia Trump may have.
A symptom of dementia, specifically frontotemporal dementia, which I think is what he's dealing with most. So
what's so dangerous about the form of dementia that he most probably has, frontotemporal dementia, is that
there's one kind of dementia related with alcoholism that's not for him. It's got confabulation where you just make stuff up. The thing that's challenging, particularly for Trump, is that, and I'm not going to make a pronouncement here. I would say this is someone that should have geropsych testing, which is like 4 to 5 hours long.
Then there's a layer of age-related dementia on top of it.
Given the article on Substack from Dr. Frank George about Donald Trump having frontotemporal dementia,
I think there's been a significant decline. He's always been driven by narcissism, but I think the dementia and the cognitive decline are, palpable, as do many experts, including many physicians. I don't think there's anybody outside of the United States who believes that Trump is sane.
All right, so back to Trump in this next disease, the number 2 disease that may be causing this problem with crossing the midline. As many professionals think may be going on with Trump, it's called frontotemporal degeneration, FTD. In frontotemporal degeneration, brain cells in the frontal and temporal lobes slowly become damaged and stop working properly. This is also a protein issue, but it's a different mechanism than Alzheimer's. These parts of the brain control personality, behavior, judgment, language. So the first signs are usually changes in how a person acts or speaks rather than memory problems. So it manifests in a different way. This is why many people think that Trump has this condition. A man with FTD would become more impulsive, less empathetic, more inappropriate, more apathetic, have trouble finding words.
Trump's threatening to invade Greenland just after he invaded Venezuela, or as he calls it,
Venezuela's.
What's next? Is he going to go into Africa and go after Namibia, or as he calls it,
Nambia.
Or maybe Tanzania, which he calls
Tanzania.
Or maybe even Azerbaijan, or as he calls it,
Azerbaijan.
After that, he can go for the Middle East, maybe the United Arab Emirates, or as he calls it,
The United Arab Emirates.
It's not every country. Trump will probably let Saudi Arabia and Russia remain independent, or as he puts it,
Saudi Arabia and Russia will repeat your.
He should remember we've got plenty of resources here at home in places like Texas, Louisiana, Arkansas, and Mississippi, or as he calls them,
Texas, Louisiana, Arkansas, Mississippi.
all of which are right here in the United States, or as he calls it,
The United States.
United States.
Play a little bit, Kim, would you, of the The president, this is just in the last day. He was at that coal event, getting the coal award and getting the nation back on track with the dirtiest energy of the modern age. And it's a quick thing, but it was apparently to professionals like yourself quite revealing. Go ahead, Kim.
And I'm proud to officially name the undisputed. When did this come out, Mr. Speaker?
So you see how he shimmies, or riffs off of that, like he tries to get you past that, like you didn't notice.
That's right.
But that's what you're talking about, right? That little slur.
Yeah. So he stumbled in the word so badly that he immediately jumped to his typical reflex, which is to speak extemporaneously. He has a speech on paper, but he will shift into something extemporaneous or ad-libbed to distract from the fact that he completely destroyed the word he was trying to pronounce. And what he struggles with is what's known with dementia patients as phonemic paraphasias, where you'll take a word and you'll rearrange the syllables or the sounds inside of that word, and you're kind of maintaining like 50% of the word's original structure. A great example would be like saying wish dasher instead of dishwasher. And so that's what his brain is doing to his words. He notices it here, and he immediately adjusts to try to cover it.
The other way that we see it in plain sight is his language. And this has been the main thing that has really been revealing his dementia. When he was in the 80s, he was extremely articulate. People might not believe that, but he spoke in polished paragraphs, not just sentences. Now he really has difficulty completing a sentence, a thought, and sometimes even a word. He evidences something that we call phonemic paraphasias that we only see in dementia or other serious organic brain disorders. It's not when you're tired or old or drunk. And a phonemic paraphasia, you use a sound that isn't an English word, but it has a part of an English word in it, and you're struggling to say the word and you can't get it out. We have dozens and dozens of examples of this.
Onto that railing, squeezing. He gets up to the car, and then he turns to his right, apparently, and starts to wander around the tarmac. And everybody's sort of like, hey, what's going on? And then, they send the guy out to point, that car, that limo, armored limo with the presidential flags on it.
He would stop and have a blank look and look disoriented, and she would kind of move him along. And then finally, he weirdly kind of stops in front of the Japanese flag and salutes it. And then he just starts to wander down the line. He's about 20 soldiers down the line when they realize it's kind of like when you take a kid to a department store and you're like, wait, what the hell happened to him? I took my eyes off him for a second. He's all the way at the other end of the room, and a soldier has to come and escort him to where all the other dignitaries are. And then she takes over and starts to escort him. So this wandering which is also, as you know, if anyone's ever had a relative with dementia, is very typical of dementia patients, has been going on for some time. He often wanders past his car, wanders past his plane, wanders.
I, as a layperson, see that he sometimes has this way of standing where he kind of hinges forward at the waist very noticeably. Or, for example, I see him walking and the trajectory of his right leg is sort of being dragged and then pulled around almost like from the hip, if you imagine it tracing a half circle in the air. I could go on, right, and give you other examples. As a professional, am I seeing things that aren't really relevant, or is there stuff here that is worthy of discussion?
It's all worthy of discussion. What you're seeing just with the gait, the swinging that leg in a semicircle at times, is I think it's a combination of, he's probably had some measure of stroke-like event, whether it's a CVA or TIA, most likely last September when he disappeared for several days. The swinging of the leg is a adaptation to right-sided weakness from some sort of stroke event, I believe. But a wider based gait is also a symptom of dementia, specifically frontotemporal dementia, which I think is what he's dealing with most. So the wider someone's gait gets, the slower their gait speed is. Those are all adaptations for an increased risk of falling, because subconsciously he knows my balance is decreasing and I need to protect myself.
Let me explain that. In other words, if your foot was just hanging loose as you swing forward,
yes,
the toes would start dragging against the ground and you
Right.
might trip or whatever. So there's a natural motion where you flex the foot so that the toes point more up than down.
That's correct. And so the adaptation of the semicircular swing to the side is an evidence of weakness. That's not the ideal, the normal way that a swing phase occurs in human gait.
Now, here is the relevant video. This is a video of Trump walking outside the White House, and he almost seems to fall down. He doesn't look stable. This is as bad as we have seen Trump's gait ever. That's GAIT. It is unusual. This is not exactly the video you would expect of a guy who just had a perfect medical exam, including the best MRI doctors have ever seen, despite not knowing what part of the body they were looking at and what the results were, or what they were looking to find out by looking at the MRI. This is a concerning video of Donald Trump walking. Now,
so he's told us, however, that he's passed endless cognitive tests, including the MoCA test. And you pointed out the last time you were on that it's not a question of doing these tests. What's obvious to any doctor or professional in the field is if you are repeatedly doing these tests, it's because you are being monitored. Your baseline is being monitored.
Absolutely.
And of course, in his first presidency, he talked about being given a test where he was asked to repeat the words man, woman, fish, television. I mean, some rando words. So we realized that he's actually been going through this before, and actually as a I want to say responsible person whose father had dementia and whose symptoms Mary Trump, Donald Trump's niece, who's been on the podcast, said she recognized. She said she looked at him one time when he was standing in the White House and she completely recognized the expression on his face, which was one of looking lost, which increasingly he does actually in videos that people release of him at Mar-a-Lago. Yes, I want to ask you about that. But can we talk about these tests? What are these tests? Are they do people actually pass them? Or what are they exactly?
Okay, so there's really two issues here. One, the fact that he's taken the MoCA so often, and the other that he's also indicated that he's taken other cognitive tests in addition to the MoCA. So as you pointed out, nobody takes the MoCA repeatedly unless they're being monitored for dementia. It might be used as part of a general screening battery for an older person if you were doing a very thorough sort of physical, and some people have even argued that should really be part of the standard battery. But you wouldn't be giving it to someone 6 months later unless you really had perceived there is a problem and we need to monitor it. We need to keep an eye on it, see if it's getting worse. So the fact that he revealed that he had taken the MoCA 6 months later again is essentially revealing that his doctors believe that he is showing signs of cognitive decline that require medical monitoring. The other thing that he said is that he took a series of tests, plural, and he kept saying, oh, and AOC and Jasmine Crockett, they couldn't take those tests. I challenged them, to a MoCA off, a test off. Well, actually, I wish those Congress people would be very aggressive about insisting that they have that test off, because I think that they would reveal how really demented he is.
So let's talk about the MRI. It turns out he didn't really have the MRI that he told us he did. Now, let me kind of set the stage here. A few months ago, Donald Trump said, yes, I got an MRI. He was asked why. He didn't know. He was asked of what part of the body. He didn't know. The White House then issued multiple statements about Trump's MRI. Yeah. And then after 2 months, it turned out that it was a CAT scan. So there are questions about that and how Trump would be so confused about what he got. But do we know that he even has received MRIs? Because now I'm thinking everybody has just been talking about this CAT scan the whole time.
Right. So I take into account also his mentioning of his cognitive assessments.
Okay.
Because of what we really believe that the cognitive assessments he's had, most likely the MoCA, the Montreal Cognitive Assessment.
Yes.
They are tracking the progression of dementia with this man. He wants to pretend like it was a aptitude test. That is no way, shape, or form what that test is for.
Right. He talks about it almost like an IQ test.
Yes. He wants us to believe they're just wanting to show the world how smart he is.
Right.
So that test is usually it's usually combined with neurological workup, which would include MRIs. I believe he's had everything. I think he's had everything. All of their messaging is always going to be a lie because they don't want anybody to publicly know how ill he really is. So I go with the clinical symptoms he actually displays, and also the things that they get the most upset about, such as him falling asleep in cabinet meetings. Those are the indicators of what's really going on with him, for me at least, because they're never actually going to tell us what's going on with him.
Would it make sense? Again, we talked about primary screening tools and MRIs, not an appropriate thing to do, even if you're the leader of the free world. You need to have a reason. Could I see his doctor say, hey, we're worried about his neurologic status, or they're seeing something that they're not coming clear on with the public, then prompting MRIs at every so often cadence? Yeah, that would make sense. That would actually be entirely appropriate to do. And that's a secondary diagnostic, secondary screening tool. There's early detection of something. That would make sense. That he is high risk for something, or they already know he has a condition, maybe a neurological issue, and they're monitoring it. That would make complete sense.
On top of that, the context of all of his likely dementia symptoms is malignant narcissism. He has always believed he is the best at everything ever and feels entitled to everything at all times.
Let me just stop you there and ask you, are you saying that this is an amplification that we're seeing of an existing condition, the malignant narcissism, or are you saying the malignant narcissism is indeed a sign of the dementia?
No, the frontotemporal dementia, it causes the frontal lobe is involved. The frontal lobe is what filters our speech, our actions, our thoughts. As his frontal lobe is literally shrinking inside of his skull, it's atrophying because neurons are dying. And this is why he had multiple MRIs, by the way. They're tracking the progress of his shrinking brain. The frontal lobe is the filter. The limbic system is our emotional impulse center. We learn over time what is appropriate, what is not. Those things get stored in our memory, many times through painful experiences where we cause damage to other people. Well, he's losing that. He didn't care about damaging other human beings to begin with, but now his brain's literal ability to stop him from doing and saying absurd things is leaving him.
I see. That does now make sense.
In control over the basic biological functions that regulate his body. So sleep, wake. Okay, so with sundowning, they suddenly become very animated and disinhibited and start acting out as it starts to get towards evening, when it should be the opposite. They should be falling asleep and getting sleepy. And then during the day, they're passing out and falling asleep. So that basic architecture of sleep, right? Sleep in the night, be awake in the day is breaking down. So he's losing control of that function. He fell asleep at the Board of Peace. I think we're going to show a piece of tape of that. Before that, this week, he fell asleep at an environmental event. But he's been falling asleep every other week at all kinds of ceremonious public events. And he hates the fact that it's pointed out in public. So he has every reason to try to suppress it. He can't. He can't suppress it.
He can't suppress it.
And it's not even just sleep. It's other biological functions. He's having trouble walking. He's having trouble talking.
That's to say nothing of what's most likely congestive heart failure and or chronic kidney disease, a possible history of stroke and or TIA.
What is TIA? Those are the little mini strokes?
That's right. The pin stroke is what you'll hear it called sometimes. Transient ischemic attack. Mm-hmm. It's not nearly as severe as a CVA, the cerebrovascular attack. So I think he probably had an event like that last Labor Day when he disappeared for several days for no reason.
You think he had the bigger one? You think he had the cerebral one or the TIA?
He very well might. I think he could have had the larger one. I mean, the way that the right side of his face drooped in later in September, it's tough to tell. Sometimes he has access to the best healthcare possible. Sure. So if he has a stroke in progress, they will have the TPA clot busting drug in his veins immediately. They will. So if he has a cerebrovascular event or whatever, his is always going to be minimized because he's going to get that drug as soon as possible. we work super fast to notice signs of stroke in our field because time is of the essence. If you can get somebody to the ER soon enough, you can get them the clot-busting drug and stop a stroke in progress. So that's another factor at play for him. What was it, a full-blown stroke? Was it a TIA? Not really sure. Yeah, there it is. I mean, that is right-sided facial droop. And again, it doesn't involve the forehead, which tells us it's not Bell's palsy. It's not the result of viral infection or some other etiology. But yeah, that's where I'm coming down on, how long I think he has left. Again, we're watching his hands bruise from some mysterious, they lie. Again, the more lying, they lie about why his hands bruise. Oh, it's from shaking hands. No, it's not. No, it's not.
That seemed like a tortured explanation to begin with. But I know that the blood thinners that are often prescribed, they can cause bruising on the hands and all over the body super easily.
Yes. Yeah. That's right. And I think, and again, the Trump administration's worst enemy is Trump's mouth. He can't shut up. He can't not mention he's taking the adult dose of aspirin against doctor's orders. He can't not mention, I had an MRI. I took 3 cognitive tests. It's like, brother, if you could just shut up, I wouldn't be making any videos. Right. But anyways, I think it is blood thinners because of how often the bruising happens and how drastic it is. He covered the entire backside of his hand most recently, and you could still see the bruising at the edges. That was just, yeah. And toward his pinky finger, you could still see the bruising in the photo that I, made a video off of. And on top of that, can somebody help this man color match?
We're showing the camouflage. Yeah, I'm sure he wants to do it himself, and I'm sure he's in a hurry or he just cakes on the makeup. I get the vanity of the situation and wanting to show up. I don't mean to seem at all sympathetic to Donald Trump, for whom I have absolutely no sympathy particularly, but I kind of understand that as your body starts to falter, you're slapping stuff on to try to cover everything, and I've seen many with that bruising you're talking about, and because of those blood thinners. So he's probably on a constellation of medications, any 3 of which could produce that same effect. It's interesting to hear you say that based on all of these things, it's sort of the sun is setting on him physically and mentally. But it's also interesting to hear you say, and there we have a couple of pictures up of the bruising that you're talking about. Yeah. It's also interesting to hear you say that it's the dementia, and then there's also the congestive failure. So the dementia is the point. I mean, in like this horse race of stuff that's going to do you in, I just don't know what horse passes the finish line first, and then when they call the race. You're kind of saying, hey, they're going to cover this up to the very last instant they have to.
Yes, they will. Another characteristic symptom is what's called confabulation, where you fill in the holes of your memory with lies that you believe yourself 100%. So anytime it's a lot different from classic Alzheimer's dementia, where you simply forget and there's nothing in that space. The frontotemporal dementia folks will fill in the holes with stuff they make up on the spot. And
about one of the symptoms that I find very interesting around dementia, and that's paranoia. What actually is paranoia? I mean, it's one of those words that we use all the time, but without, I think, probably a true understanding of what it actually means. And I feel like you can give us both the sort of root of it and how Donald Trump is displaying paranoia.
So look, this is what's sort of frightening about this deterioration that he's going through. Donald Trump was paranoid before he developed dementia. Okay, that's the nature of malignant narcissism. Paranoia is one of the core component traits. That's why when you hear him speaking in these very articulate talks in the 1980s, he's like, China, they're just trying to screw us. They want to manipulate, blah, blah, blah. So it's still, we're being screwed, right? It's still the paranoia, but at least the sentences were comprehensible. Now, as he's starting to deteriorate, one of the signs of dementia is people becoming more paranoid. The paranoia is becoming more grotesque, more primitive.
But what does paranoid mean? That you think that other people are coming after you? Is that the essence of paranoia?
Yes, well, you feel like people are threatening you. They're trying to hurt you. You're projecting onto them, actually, your own aggressive and destructive impulses. I just wanted to give you an example, by the way, of how his paranoia has gotten worse. Do you remember that scene where he was talking to children? He was sort of playing Santa.
Yes,
they were calling
How
into
could
the
we
White House
forget
and
that
asking.
scene? Yes.
That's right, and officially the White House tracks Santa's sleigh. That's a sort of a faux thing that they do every year. So he said to one child, we track Santa all over the world, and we have to make sure that Santa's being good. Santa's a very good person, but we have to make sure he's not infiltrated. That we're not infiltrating into our country a bad Santa. I mean, how crazy to be paranoid about Santa.
I know.
Santa might be infiltrating us.
Although, to be fair, Santa, or at least the image we have of Santa, actually comes from Coca-Cola, right? That Santa used to be green as St. Nicholas, and then it was an ad campaign to make people drink more Coca-Cola that turned Santa red, or put him in his red suit because it's the same color as Coca-Cola. So I understand why people might be paranoid about Santa.
So again, what people need to understand about dementia is it only gets worse. So this is a sign that this is deteriorating.